Welcome to the Guidance Functions webinar on patient record data. In this webinar on patient record data, we will cover the following areas. What is patient record data and where and how to access patient record data? Patient record data consists of individuals' health conditions and other confidential information. It is all data that relates to patient treatments like medical records, nursing records, registration forms, X-rays, and discharge summaries. Biological samples are not included in the patient record, but the results of analyses and examinations of biological samples are part of the record. Where to access patient record data? Patient record data can be obtained from many different places. It can be obtained from departments and clinics, but also from regional business intelligence offices that supply data from the hospital's IT systems and have several regional databases at their disposal. Much of the health data available through the National Health Registers is also available through the regional databases at the business intelligence offices. Data is provided to clinicians, hospital management, regional directorates, and politicians, but data can also be provided for research use. For instance, datasets can be provided for sending out questionnaires to a specific patient group or data on laboratory results. There are some approvals that is required before being able to access patient record data. First of all, it requires a record of processing activities. All projects that store or process personal information or data must be listed on the record of processing activities. A record of processing activities is documentation of information about who processes personal identifiable information, which data is used, and for what purpose. An exception are projects where only anonymized data is used. These projects do not have to be reported to the record of processing activities. The record of processing activities is available in the regions and at the universities. Private companies must keep records of processing activities themselves. Notification procedures, templates, and such varies among regions and universities. Where you have to report your project depends, among other things, on where you are employed. In the region of southern Denmark, notification to the record of processing activities is based locally at the hospitals, but in other regions it is collected regionally. According to the Danish Health Act, patient records can be used for research, statistics, and planning. A permission is required to have patient record data transmitted. Permission to transmit patient record data was in June 2020 passed on to the regional councils. The permit must be applied for in the region where you work as a researcher, and this also applies if you have to apply for extension or addition to your project. Extensions and additions apply, for instance, to extending the time period, the number of patients in the project, or access to additional information. In addition, you must remember that you can only have data transferred that is relevant to your study, meaning that you cannot get transmitted the entire patient record. You must be aware that permission is only given from the regional council for you as a researcher to have the information transmitted. That means that the researcher must arrange the transmission with the department that has the data or the business intelligence offices. It may be a good idea to contact the department from which you want the patient record data early in the process to ensure that time and resources will be set aside to obtain the data and hand it over. There are some exceptions where it is not necessary to apply for permission for transmission from the regional council before you can access data. One of the exceptions is consent. Permission for transmission is not required if the patients have given written consent for the transmission of patient record information for the specific research project. Consent is obtained directly from the patient and is waived no later than 1 year after which a new written consent must be obtained. Another exception is quality assurance and quality development projects. In the case of a quality project, permission for transmission must be applied directly to the management of the processing center that has the requested information. The third exception is quality databases. If information is requested from an approved quality database, for instance, the region's Clinical Quality Development Program, the application should be directed directly to the database's administrator. The last exception is the approval from the Scientific Ethics Committee. If the researcher has a scientific ethics approval in which permission for the transmission of patient record information is included, then approval should not be sought from the regional councils. This was the Guidance Functions webinar on patient record data. Thank you for watching.